1. Early detection and continuous monitoring is the golden advice. Check your blood work or do the blood tests regularly. 2. Avoid foods high in saturated and trans fats, sugar, and sodium. Fruit juices are thought to be healthy by many because of the nutrients, but in reality, they can very high sources of sugar. 3. Some studies conclude by recommending at least 150 minutes of moderate intensity aerobic activity or an increase in activity level by more than 60 minutes per week. 4. If you have diabetes or pre-diabetes, managing your blood sugar levels is crucial in preventing or reversing MASLD. 5. Keeping your cholesterol levels in check can help decrease the risk of developing fatty liver disease. Your doctor can help with that. 6. Alcohol can worsen liver health, so it's best to abstain from alcohol consumption. 7. Current research recommends that losing weight is the single best thing you can do to control or reverse NAFLD. Do not just think you are not heavy. Compare your BMI or body mass index with the best in the class. It should better be under 23 to 24 for Asians, Indians and most people with colored skin. My height 6 feet 5 inches, and my waist is 2 feet 8 inches, which is okay. I am taking all attempts to bring his down even more. A good goal is to lose 10% to 20% of your total body weight to start. Also, check your waist circumference near the belly button. It should be less than half of your height. Talk with your doctor about the best way for you to lose weight safely and effectively. Fatty liver disease, where too much fat builds up in the liver, can be caused by alcohol or other factors. This disease, called NAFLD when not caused by alcohol, is the most common long-term liver issue in the US. While the exact cause is unknown, it's more common in people with obesity and diabetes. While we are in the middle of the video, do not forget to hit the like button while watching this video. See the description and comments for reference. We would appreciate your comments in any language. The early stage, steatosis, often has no symptoms. However, it can worsen to cause serious conditions like liver cancer. The main treatment is a healthy diet and exercise to manage diabetes and reduce weight. In severe cases, a liver transplant might be needed. As we age, some cells become damaged and stop dividing. These senescent cells accumulate in the liver and other tissues, possibly contributing to age-related diseases. Researchers studied the role of senescent cells in NAFLD. They found that mice on restricted diets had fewer fatty livers and less evidence of cellular aging in the liver compared to mice on unrestricted diets. Restricting diet also protected mice from these aging signs. The team then showed that removing senescent cells in middle-aged mice reduced liver fat. They achieved this through two methods. Genetically modified mice. These mice allowed researchers to selectively eliminate senescent cells. Senolytic drugs. New drugs called senolytics kill senescent cells. These drugs also reduced liver fat in a mouse model of type 2 diabetes and liver steatosis. The researchers found that senescent cells were poor at processing fats. This suggests they might have faulty mitochondria, the cell's power source responsible for fat processing. This could explain why fat accumulates in these cells. In human liver samples with NAFLD, they found increased senescent markers linked to fat accumulation. This suggests that senescent liver cells might be a factor in NAFLD. Dr. Diana Jurek, lead researcher, says, "As we age, we accumulate cell damage, and we have shown that these older cells are storing excess fat due to their inefficient mitochondria. What is exciting is that we have been able to reverse this damage in mice by removing these older, worn-out cells. With rising levels of obesity and diabetes, fatty liver prevalence will increase in the future. It will cause considerable morbidity and mortality. Significant percentage of patients with developed NASH which may progress to cirrhosis. Then to end-stage liver failure and hepatocellular carcinoma. Despite considerable research and multiple clinical trials, data on the efficacy and safety of pharmacotherapy in the treatment of NAFLD remains inconclusive. The best treatment for the condition remains lifestyle modification, especially losing weight. It can be done using a combination of diet, exercise and behavioral therapy. If pharmacological therapy is being considered, It should be tailored to the needs of the patient. In all cases, careful pharmacological control of cardiovascular risk factors, hyperglycemia, dyslipidemia and hypertension, is mandatory in order to decrease the burden of cardiovascular disease, accounting for considerable morbidity and mortality in NAFLD. While researchers continue to explore targeting senescent cells for treatment, careful study is needed due to potential side effects. Do not forget to click the like button. Thanks very much for watching this video. Up above you see 2 videos related to health. It will be more helpful to you and your family. See you in the next video.